Joining me now is the chairman of the House Intelligence Committee, Adam Schiff. He is calling for a Truman-style commission about the federal government's handling of this crisis. Mr. Chairman, very glad to have you on the program. We appreciate your patience as we have come to start our conversation with you. And based on what we just saw from the president, I do want to ask you about this commission that you are proposing. As you listened to him talk about where we are now, talking about, I believe that the quote was something as though who would have expected this pandemic, something like this. I think it's clear that there are experts throughout the government whose essential functions are to prepare for something like this. What do you think went wrong here, and what do we need to do to figure it out?
Well, I think there's been a lot that's gone wrong with the president's leadership throughout this crisis. Even before, frankly, the pandemic began, even before this virus emerged, he disbanded the office that his predecessor, Barack Obama, had set up in the White House to monitor for pandemics. And I think it was probably part of the Trump administration philosophy that everything that went on during the Obama administration was inherently bad. And he wanted to dismantle anything that was associated with it. But that was catastrophic, that decision. Then the failure to take this seriously, the failure to listen to the advice of his own experts, the weeks and weeks that went by where he talked this down as an ordinary flu, the failure to order protective equipment and ventilators when we could have filled our stockpiles with them. There are any number of failures. And I think that the importance of a 9/11-like commission here that would begin next year, I don't want it to be involved in terms of the politics or the election, but to begin next year, a very objective, nonpartisan review of what went wrong, what we need to do to better protect the country in the future. And last thing I'll mention, Casey, is the very last question at this press conference illustrated exactly why there needs to be oversight. That was when the president cut off the Associated Press reporter who was trying to ask a very important and simple question about whether the administration missed an opportunity to get ventilators when it could have, or taken steps earlier. You could see the president wouldn't even allow the question to be asked and then went storming off. This is a president who does not want oversight of his handling of this, doesn't want the inspector generals to do their job, and just fired the intelligence community one on Friday night in a Friday night massacre. It's all the more reason why we need to do oversight.
I'm glad that you raised that was a question from my former Associated Press colleague, Kevin Fricking, who has actually covered Congress and healthcare as well as politics generally in Washington for a decade plus, just since I've known him. And he is someone who has asked many very serious questions, as the AP typically does. So thank you for that. I want to ask you as well. It's clear that our intelligence community had some warnings about this before the Chinese government was willing to be public about the scale and nature of this. Chris Murphy, Senator Chris Murphy, tweeted after he left an administration briefing on coronavirus. He said that they weren't taking this seriously enough. There were some warning flags that I realize you're not allowed to talk about classified information, but in your role as a member of the Gang of Eight, do you feel as though there was information there that should have set off red flags much earlier with this president?
I think there were a whole variety of sources of information. The intelligence community was one of them, but you had information coming from the WHO, from the CDC, from the president's own National Security Council. There were lots of people, lots of agencies, domestic, our intelligence agencies, as well as foreign health organizations that were sounding the alarm at various times. And, even up through the end of February and into early March, weeks after it was abundantly clear we were dealing with a life or death threat, the president was still making happy talk about it and engaging in what we see to this date, which is departing from the science, departing from what epidemiologists have said, and wishing to create his own narrative about events, which during a pandemic is really dangerous. The fact that millions of people that tune into these briefings can't tell unless you fact check him whether what he is saying is true or untrue, whether they can rely on what he says about treatments, or they can't rely on it, whether they can rely on what he says about vaccines or they can't, that is really dangerous for the country. And so, yes, there were warning signs, I think, across the government. And those were ignored for a very long time by the president, even when his own advisors were telling him, this is serious and we've got to get prepared.
Based on what you know, do you believe the Chinese government when they say their official death count is just over 3,000 people? Can we trust those numbers, and can we trust what Beijing is saying about this?
No, I don't think we can. Now, how big the variant is between what they're representing in terms of their death toll or rate of infection in China and the reality, I don't think we know. But no, we can't rely, I think, on the numbers that China is giving out, both because I think the Chinese leadership probably wants to present their model as the successful model. And given all the problems the United States is having, this is, among other things, a propaganda coup for China to be sending medical equipment to the United States instead of the other way around. But also because, historically, when there have been viruses or other health or other problems in China, there are people that lie to the Chinese government, lie to their own government, lie to their own people because they're afraid of retribution by the officials higher up. So I don't think we can rely on what we hear from China. We're certainly on the Intelligence Committee trying to find out, okay, where is the ground truth in China, as well as in other countries that likewise may be misrepresenting and potentially substantially misrepresenting how many people are infected. We can't rely, for example, on what the Russians say about what's going on in Russia. We can't rely on what the Iranians are saying about what goes on in Iran. And because the virus knows no borders, it's important for us to find out the best we can where the truth lies in terms of where the virus is and what the impacts are.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.